Now, should people be fined for missing GP appointments? 020 7862 2222. Give us a call. The former Health Secretary Sajid Javid has backed a report calling for people to be fined if they miss their appointments. The Policy Exchange think tank was looking at ways to cut down on the 15 million appointments missed every year. Researchers say a single face-to-face appointment with a GP in England typically costs the NHS £37. Would fines change that, Wilfred?
I think fines are a rubbish idea, but I do think that the NHS has a problem. I've got a very, very simple solution. Simply this. Every time you make an appointment, you put a deposit down. Everywhere you go in society now, whether you're going to a restaurant, you've got to put a deposit down. You get the money back if you turn up for your appointment, and if you don't, you lose it.
What if somebody can't make their appointment because of a mental health crisis?
Yeah, but you could ring up, like every day you got to ring up 24 hours in advance, ring up.
They can't do that.
Well, look,
and then everyone says I couldn't make my appointment.
Jeremy, the reason why we never do anything
crisis.
Somebody comes up with what I call a ridiculous scenario. Okay, there are going to be exceptions to the rule, but it's a pretty simple principle.
Deposit, pay it like bottles.
It's not a bad idea.
Bottles.
Although it's already such a fankle, isn't it? Trying to get a doctor's appointment. The idea of also inserting your card details. I mean, that's where I'm melting in front of my computer. I think the problem with the missed appointments and the fines for them, it means the most vulnerable will by definition be targeted, because it's those with the most chaotic lives who are least likely to make their appointments, and therefore you're kind of doubling down on their position of vulnerability. That concerns me.
Can I make it just a thought here?
Yes.
That missed appointments are a great thing and they're part of what we need, because at the moment, if everyone turns up for their appointment, you get 8.5 minutes. So if I go to the GP, which I can't even get one appointment normally, but if I were to go, I'm relying on the next person to miss their appointment, so I get 16 minutes instead of 8.
No, but I talk really, really fast in my doctor's appointments.
You want to do 8 minutes?
Yeah, I make sure I never am in there longer than about 5 minutes.
Well,
because
how
I worry
can you
about
describe a boil or something in less than 5 minutes?
You can do it really quickly. I went in to have my breast looked at, and I was in and out. You've no idea. And she said, "Do you want a chaperone?" And I was like,
"Yes, that happened to me."
I was like,
the chaperone. Seriously,
your breasts?
No, not for my breasts. I went to but there's certain procedures they've got to go and get a chaperone. It's just absolutely gone crazy.
It's bonkers. This was a lovely woman, and twice she asked me, and I said, "No."
This is a woman asking.
A woman said, because she said, "Do you want, And I said no. And then she asked me again, and I thought maybe she's wanting the chaperone.
Well, this is where the money's going.
This is so slow. That's what's slowing it all down.
But so you don't agree with my thing that a certain amount, rather like with the flights in aircraft, they budget the airlines now. They think 10% of people don't show, and they sell their seats. Right? Because they work it out. That's why sometimes you have the horrendous situation where they've actually oversold the flight and they start to try and pay people to come off. Now, I reckon doctors' surgeries must be doing that already. They think if we've got 60 people booked in today, 6 of them won't show.
Well, and of course, if they all do show, that's when you get those real delays. And that's where sometimes you have to cancel your appointment because you can't wait as long as is required.
Well, OK, I don't know. Maybe that's the answer. But
sometimes...
But you want to find them anyway.
I don't want to find them. I just want them to have to pay a deposit. And also, I think a lot of people are going to the doctors when they don't need to. And that's why some sort of triage system you need to have in place. Because actually, I was reading somewhere that in China now, it's all have AIs that operate. Because actually, all a doctor does is go through this checklist. Then also this checklist will then tell them what you then need.
Absolutely. But there's a real resistance to AI. Even the triage idea, even the idea that you look on your phone at an AI person who will say, "Where is your pain?" and you'll say, "It's in my head." Is it a brain tumour? No, it's not. Is it a migraine? No, it's not. Even that very much resisted among older people. But, because if you haven't got a smartphone, for example. Richard's in Essex. Hi, Richard.
Oh, good morning, Jeremy.
What do you think about just doing something like fining people who miss GP appointments?
That's all very well, yeah, but will it work both ways? If the doctor fails to meet the appointment, I went down 7 times. My wife has to take me. I'm disabled, right? Yeah. And when I turned up the 7 times, I'm sorry, the doctor has to cancel your appointment. They haven't even, I'm on the phone. They could have rung me and said, your appointment's cancelled, but they didn't do that. Is the doctor going to get fined?
And you said 7 times?
7 times.
Cancelled? That is wicked. That doesn't. I mean,
Yeah,
that
well-
you're right. That if you can't make an appointment or yours gets cancelled, you should get money back for that. You would support that, I bet, Wilfred.
I definitely would. That's happened, not 7 times, but it happened to
You
me
need a
once
think tank.
when I've been there and you turn up. Oh, sorry, we've had to cancel your
Never,
appointment.
I've never had that. I mean, because
Oh,
nowadays
yeah,
you
I've had
don't
that.
you don't meet the same doctor each time. You have a lot of people who are
Yeah, and
sort of
well,
random.
it's not actually understanding that other people have busy lives.
I know.
Really.
Yeah, thank you, Richard. Michael on the beautiful Isle of Man. Hello.
Hi, good morning, Jeremy.
Good morning. What do you think of this then? Fining people who don't turn up.
I don't think that fines would be appropriate. Although I work in the Isle of Man, I'm based in Scotland, and what we do in National Health Service Scotland, when you make a GP appointment, you receive a text a couple of days beforehand saying, if you miss this appointment, the cost of that is roughly £135. When you've got a letter from the hospital to attend, you get a letter telling you, if you do not turn up for your appointment, this will cost £235.
I see. They're telling you it's not a fine on you. They're telling you how much it will cost the NHS.
They're telling you what the cost will be.
Well, that's quite a good way of guilting you.
I think that is a really good way. Now, I don't honestly know how much it saves, but I work within the care system, and I have done for 37 and a half years as a senior nurse.
Okay.
And I find it absolutely baffling because we see these reports, we've watched reports continuously since the onset of COVID about backlog, waiting list. If people are unaware of what the cost is, we need to re-educate the general public.
You see, what about my thought that the GP surgery rely on having 20% cancellations because otherwise they haven't got enough time for their patients?
I don't honestly know that I agree with that. We need to make time for patients. Patients are the core of every single thing that we do within the care service.
Okay, thank you, Michael, very much indeed. Charles in Cheshire, hi.
Hello.
Hey, you all right? Oh, look, you've got the last caller still on your TV. You might need to mute your TV, my friend. Charles in Cheshire, hi.
Switch it off.
Well, mute it or turn it face the wall. You've got the last caller still on your TV. There we are. You can see the sign now. I think just mute is fine. Yeah,
fine.
Great. Well done, Charles. Thank you. Where were we?
He's muted himself.
Is he still there?
Oh, he's muted himself.
Yeah, I'm still here.
Well, all right, Charles. What would you like to say?
I'd like to say abandon the appointments, and anybody wanting to see the doctor, go to the surgery and ask to see the doctor.
It's tempting, but there was a thing 20 years ago in Edmonton, North London, called the IKEA riot, where they put on sofas for £48 and they had serious public disorder. And I do worry, Charles, that a doctor's surgery could get mobbed if they simply said, we're not taking appointment calls, we're not having an online booking service, you turn up when you're ill.
Doesn't work.
Does it not work?
It only works if you've got all day to sit and wait. I've been digging into these suggestions. Introducing fines for missed appointments is just one. The other one is scrapping free prescriptions for the over 60s. Jeremy, you've had a significant birthday.
Yes, I have.
You get free prescriptions.
Well, yeah, if you're assuming I'm on some sort of medication.
I know, but I think it's ridiculous that people over 60 get free prescriptions. You're way richer than me, and Wilfred, you get free prescriptions. We've got the solution
you don't
right
know
here.
who's richer than who.
No, I tell you what, if you have, like, for example, I had leukemia, it means that you have to have medication all the time. That can become very, very expensive.
Well, she wants to take your medication away.
I want you to pay for it. I don't have a problem.
But no, that'd be unfair because I'm having to every week. I have to have this sort of medication.
But if you were under 60, you'd have to pay for it.
Well, no, there are certain illnesses, and the older you get, the more likely you are to have these illnesses, which means you're going to need to have medication.
Which is where a big saving could be made. We don't retire now till we're about 67. So I think as long as you can work, you can pay.
It's assuming that people are healthy, and that's where it doesn't work. If you're not healthy, you could operate, but you need this medication.
I think it's very interesting. Charles, what do you think of that? If you're still there, the idea, Tessa's idea. What?
I just can't understand why you going on about appointments, because if you make an appointment, what you made the appointment for might be cured.
Well, yeah. I mean, that seems to be the modern way of the GP surgery working, is you can't get an appointment until you're better.
Yeah, that's right.
I can get an appointment on the same day.
How do you do that?
Because I'm 50 with breasts. I mean, it just depends what the problem is.
What do you have to do? You have to say use a code word or something?
No, I got an appointment within half an hour. It was extraordinary. And then I was in the hospital within 2 weeks and I've got the all clear. It's been amazing. I can't criticise.
Oh, I see. So you had a need because you had a lump or something.
But my point is, I think they sift, don't they? They work out what's the priority.
Well, there are certain.
Do you think?
I have heard people say if you say a balance, you're straight through.
Yeah.
Anything to do with balance. Because there can only be one cause, which is, brain tumour. Thank you, Charles. Amanda, Lancashire. Well, we're ranging today. What would you like to say?
I don't think you should be fined because there's very many reasons that you may miss an appointment. My example is quite a few years ago that I mixed up 2 appointments and missed 2, one at the hospital and one at the GP's. Because my head wasn't in the right space, because my mum had just passed away.
Wilfre fine you. Does it? Doesn't. He disregards that as an excuse, I'm afraid.
Because I mean,
I'm sorry, Amanda. He's playing hardball here.
And you could have rang them.
No, her mother had passed away. You can't use the phone in a state of grief.
You can text.
Or get somebody else to do it.
I'm sorry, Amanda. There's no. I must apologise because there seems to be no sympathy here at all.
No, there is sympathy, but I think that one of the problems is, Amanda, often the coalface of the NHS, they're dealing with vulnerable people. We don't, unless it's pregnancy, which is slightly different, but again, it can get sticky.
That's true. Everyone has a problem.
Generally, everyone's having their own mini crisis, and therefore they've all got a good excuse for missing their appointment, and that's what they're saying is costing money, isn't it?
Amanda, thank you for calling. I appreciate this. There are good reasons why you might make that slip, and I hope all is better for you now. After the break, it's the papers and everything else included.